Hello everyone, welcome. I'm Dr. Sharif Al Halim and today I'm going to talk about childhood developmental milestones in infant period. So the early developmental milestones are very important to know, not only as a medical student or a doctor but also as a future parent. So those developmental ranges or dates are ranges that have been approximated, and those milestones should be assessed in every child after certain periods of time, and if they have some problems, they need to be assessed for potential developmental delay. And the skill sets that are commonly assessed in a developing child are motor, social, and verbal or cognitive skills. So let's talk about the infants, which are the age range from 0 to 12 months or 1 year old. So for remembering the skill sets that the child develops during infancy period, you have a mnemonic which is parents start observing. So this is a mnemonic which I brought from Fast Aid 2015 edition, and each of the first letter of each of the words actually points out to each of the skill sets. So parents, P for motor, S for social, and O for verbal or cognitive skills. So let's first start with the motor skills. So for motor skills, we have the parent word and the P. So there are multiple sets of motor skills that a child develops during the period of infancy. One is primitive reflexes. So primitive reflexes are actually present just after birth, and they actually need to disappear, not to appear. They need to disappear after a certain period of time has passed, because if those primitive reflexes don't go away, the new motor skills can be learned by the child, so they are needed to be gone. So the common reflexes are motor reflex, which is commonly gone within 3 months, the routine reflex by 4 months, palmar by 6 months, and the Babinski sign by about 12 months, it's gone. And the posture, which is very important in infancy. So the posture development starts first with the lifting of head up when the baby is prone. It is achieved by about 1 to 2 months, and then the baby starts to roll, and ultimately the baby can sit by about 6 months. By about 8 months the baby can crawl, and then the baby can stand with support by about 10 months, and the baby can walk by about 12 to 18 months. So whenever a baby cannot walk when he is over 18 months, that's an important sign that the baby has some problem with his development. Or whenever a baby cannot sit when he is over 9 months or 10 months, now there is a concern of developmental delay. The baby can also pick something, so the baby can pick and pass the toys from one hand to his other hand, and it's achieved by about 6 months. And the baby can also have a pinch or grasp, so baby can grasp objects, the flat objects, with 2 or 3 fingers, and the baby also can point to object by about 12 months. So here I have a picture to show you the development of the posture. So very important to know. So first, within 1 to 2 months or even 3 months, the baby can actually lift his head up when he or she is prone. By 6 months, the baby can sit without support. By 12 months, the baby can stand and the baby can walk or take steps. Here I have a video for you to show what are the important skill sets, the motor skill sets that are achieved during the period of infancy. So first, now you can see a baby that who is trying to lift his head up, and this is achieved within no more than 3 months. So let's start seeing the video. So baby is trying to lift his head up. You can see the baby has lifted his head up. This baby is trying to roll over from stomach to back. This baby is sitting without any kind of support by about 6 months, and this baby is crawling to get something and it occurs by about 9 months on an average. Now we can see another baby who is about 9 to 10 months, and the baby can stand with support, and by about 10 to 11 months the baby can stand without support, like this little cute angel. The baby is actually standing without assistance, and by about 12 months the baby can take the first unassisted steps. It's amazing. Okay, so here you can see some other skill sets that a child is showing. Now you can see in this video the child is showing the pincher grasp. And this is achieved about 10 to 12 months. So the baby is grasping flat tape with his fingers. So using his two finger and pinching it. Okay. So the next part of the sentence was start. So our mnemonic was parents start observing. So P for motor, start, S for social. So now let's look at the social skills. The most important social skill that a baby develops is social smile, and the baby develops it by about 2 months. And the baby smiles in response to a human face. And there are two important mechanisms, the anxiety mechanisms, which are stranger anxiety. So whenever the baby sees someone who he or she is not acquainted with, she or he starts to cry or showing tantrums or emotional outbursts, and it's developed about 6 months. And the baby sometimes develops separation anxiety. Actually, most of the times develops separation anxiety by about 9 months. And separation anxiety is something that the baby cries or shows emotion when the caregiver, the primary caregiver, maybe the mother, actually leaves the baby, and the baby sees that there is no caregiver, and now she or he is having an anxiety which is due to separation. And the baby in this period also starts to play social games like peekaboo, and also develop social attitude like waving bye-bye. So here you can see a child who is playing peekaboo with a toy or doll. So she's playing a peekaboo. Okay, let's go to the next slide. The last part of the development of infancy, which is the verbal or cognitive skill, we can remember it by observing. So our mnemonic was parents start observing. So O for observing, so all the O's here. So orientation, object permanence, and oratory. So orientation is by the first 4 months the baby starts to orient by voice or to voice. So baby responds to voice, and then the baby starts to respond to name, his or her name, and also to gestures. And another important skill of development is object permanence, and object permanence is actually developed by about 9 months. And here the baby can develop and maintain a mental image of an object or of the mother without seeing it or seeing the mother. And the vocabulary or the oratory includes mama or dada by about 10 to 12 months. So you can remember by first birthday the baby can take his or her first step and can tell the first words. So here you can see a video showing you the object permanence. So the baby have first seen that object. Now the object is out of his eyesight, but it's in his mind. Now he finds the object. So this is called object permanence. So that's all from me today. Thanks for watching my video.